Okay, my name is Eliza Mwale Mwase. I am from Malawi in Africa. I came here for the program of Merck Foundation of Africa Oncology Training Program. I heard this on their broadcast in our country that maybe they want nurses to come here in India for oncology nursing training. There was someone in the place where I'm working in the State House who also recommended me to come here to do this. So I'm here to pursue this training. I'm almost done now. Okay, in our country there's a lot of challenges, but the biggest one is the first one is there's no like human resources like the qualified ones to work on oncology. There are only a few who are specialists who are working there in the oncology hospitals, because there are major two parts of oncologists in Malawi. That's in Blantyre and in Longwe. So there are not enough trained personnel to work there. And the second one, it's on resources. The resources there is not enough to sustain or maybe to help those people who have this problem of cancer in our country. So this is the biggest challenge, because there are patients there who are having this problem, but maybe because of we don't have enough medication to give them. The chemotherapy treatment is not enough for them. So that's the most major challenge. A lot of people are dying maybe in their homes because there's no one to take care of them. There's no medication for them, even if they can go to the hospital, but sometimes they will tell them that there's no chemotherapy to come in for them to be given. So sometimes it's when they go home as like a palliative patient, but it's not like the way it's supposed to be, as I've seen here in this India country place. So for me, these are the two major challenges: the specialists, the people to work there, or the nurses, the whole staff, and the resources. It's not adequate in our country. Yeah, as I said, for me, I've learned a lot of things, like how to take care of the patient, how to be dedicated when you are caring for the patient. I've seen the nurses here in India, they are so helpful, and they have the knowledge, and they have all the capability of how to take care of the patient. That's for me. But for the patient, if you have all the knowledge and you are able to help the patient, that means the outcome of the patient is also good. So this also helps a lot. And for the country, I'll help other nurses who are not here, who are there, they don't have enough knowledge. I'll help them and mentor them on how to take care of the patient. Yeah, I've seen the way the treatment itself is given to the patient. I've seen a lot of different types of treatment. Like it was new for me to see the PICC specifically, that I've seen the patient going home with PICC for medication that will take for maybe 48 hours. We don't have that. So for me, it was a great exposure. And radiation in our country, we don't have radiation. It's only for chemo and surgery. So these two, and the structure, how nurses, it's also exposure to me, how they management, the way they do things, they do it in a good way, like a good protocol. If there's something, the nurses should go to know who to approach, where to go before doing maybe anything further. But that's a good approach for me. That is an area of exposure that I've learned a lot of things, and how patient the nurses are, how they talk to the patients is also another exposure to me. So it's a great exposure for me that I've seen all these things here: radiation, treatment, and nurses' approach to the patient. In that question, I think the best way is when I go there, because I have these small skills, I have all the knowledge, what is happening here, how to take care of the patient. That means when I go there, the most important thing, is also to do exactly the way things that had been done here, if that is possible, apart from resources problem. But for mine, I have to take care of patient and train other people, like you have, we call it CPD. CPD is when you train each other, we mentor each other, that this is the way we are supposed to care for the cancer patient. Maybe if you have this problem, we have seen this problem, this is the way we can handle. I'll be going maybe around doing CPD in our country to help those who are not here, at least to improve the care of the patient, cancer patient in our country. Yes, this is the Merck Foundation has done a great work for us. To be here is a great privilege, and I thank them because I've been exposed to a lot of things that I haven't seen in my life. Because in our country we just learn not much, we don't go deeper in oncology. You just go from school, then you go there, you don't get trained as the oncology. So coming here, it's a great privilege, and I also thank the First Lady in our country for doing this for us. They should continue training more and more nurses and doctors for that. That will help a lot of caring for the patient in our country. Thank you. Malawi.